Hello, everyone. My name is Janet Peters. As Director of Health of the NET Doe Memorial Foundation, one of my roles is to ensure that we have supplies needed in order for us to operate efficiently. Over the years, we have partnered with several organizations that has enabled us to provide free medications, basic first aid supplies, dental hygiene kits, girls' menstrual pads to our students during the school year and during our free community health fairs. We have partnered with the community, providing diabetes, high blood pressure, stroke prevention, STIs, education and prevention, malaria. This could not have been possible without our outstanding team. May I introduce our team. For the U.S. base, we have Eleanor Basilo, Director of Healthcare Education, Amanda Thomas, Director of Administration, Frances Yang, Director of Quality Compliance, Patience Wise Tijan, Officer in Charge, Liberia Base, Eric T. Weir, Quality and Clinical Coordinator. At this time, I would love for you to hear from our local residents, our students, how they have been impacted from our initiatives. And then also, I would love the opportunity to have you walk through the clinic with us.
Student Vera Jimmy from NET Doe Memorial Academy, number 11 free class.
Okay.
I have benefited a lot from the health club. Firstly, I was taught about knowing my menstruation cycle. If I see my menstruation, what should I do as a female to prevent myself from getting infection, and also how to use the sanitary pad. In the other time, our sponsor helped us with a sanitary pad. It helped us a lot, but there was other girls that don't know how to use it, and through that, we all know how to change our pad regularly, and I'm so glad for that.
Why do you say important to have this health facility situated in this environment?
This clinic that is about to be open for this community in this school will be very much important and helpful to the school and even the community. Like the other time I came to school, I was feeling ill, and the nurse from the health club, she came and tested my blood. She said I was having malaria, and it helped me. And it will even help the community dwellers to help their children. Like at night, the child feels sick, and for here to go to the government hospital is very far. So it will help them. At least you can take a little walk, you will reach to the clinic, and you'll be able to help your child or children to feel well. There is such shame.
Okay. What benefit you had from the health fair?
The benefit I had, no one that have pressure. But when the health team came here, when they check on me, they knew that I have pressure. They are taking the tablet, so I know myself that I'm a pressure patient.
Okay. So having this clinic in this community, why is it important to have this clinic in the community?
The important is in the community. Our children can get sick, someone can get help. Myself, the oldest people can get sick. From here to government hospital is not easy. So now you not get more by late hours. So if the clinic come here in the name of Jesus, we're able to bring our child here for treatment.
Okay. So what can you say to the people who are watching and listening to you? What recommendation do you have for them?
Those that are listening to me while I'm saying, I'm praying to the Almighty God. Let God speak to them. Let them bring our clinic for our health.
My name is Tina Garnier. I never knew that I have pressure and sugar. But through the health team, I get to know that I got pressure, I got sugar, and now they are treating me, and now I know my status about my pressure and my sugar.
Why is it important to have the facility in this community where you reside?
If we get a clinic in this community, it will help us, and also it will help our children, because to leave from here in the night and go government hospital is a long distance. But at least in this community, when we have the health team here, then it will help our children. Even if we sick, or even the student, if some of them they are sick, they were able to rush to the hospital, and for us to take them to government hospital, it will help us.
That's nothing. The healthcare of Anti-Do Foundation helped me to know my status, because I never knew that I was suffering from pressure. But through the health center, I got to know that I was suffering from pressure. And they've been treating me. So I tell them, thank you. At least I know my status.
Why is it important to have this health facility here in the community?
They're very important to the community and the school, because it will help our students, it will help our children in the community. Likewise, for we the people, it will help us. Because when we sick and then we want to go to government hospital, at least we go to work on Anti-Do campus to get the treatment.
What could be your recommendations to those of the people who are watching and listening to you?
I'm appealing to them as you help Anti-Do Foundation to finish the clinic so that we can benefit from it.
My name is Brother Levi B. Sherman.
Okay. So, Mr. Sherman, what do you know about the Anti-Do Memorial Foundation?
I want to first bless God for this foundation. Where I know about the foundation, we give free education and free health facility within this particular community.
Okay. I know you benefited from the healthcare program.
Lot of things are benefited.
What can you say about it?
Yeah, first of all, I know that they know me to know my status, because I'm a pressure patient. And I went there, they took my BP and my sugar test. And they gave me some medical treatment. I took it, and well, I did a terrible thinking to improve my status. And I appealing to them to please help us to open our clinic, because now no way for us to go to the hospital. And they hear my voice, we say thank you to them, to the donors, thank you to the family, thank you at large. We say, please open our clinic. We're begging them, but it's very helpful to us. So we are begging them to open our clinic. Let our children, our students come to our clinic, because it's no way for us now. So thank you so much.
My name is Eric T. Weir. I'm a nurse, a mental health clinician, and an addiction professional. Work with the Ministry of Health at the mental health unit. I have been working with the Anti-Do over 5 years now, being part of the health fair activities. If you listen carefully to some of the community dwellers, they already share with you their own testimonies. The health fair is important because it helps to allow people of the community know their health status, to be able to manage their health condition and take prevention measures that will help improve their lives. So the health fair is very important. Having such intervention like the clinic in this community will help save lives, because the distance between government hospital and the Sugarcane Farm a bit stressful. So having this clinic erected and operational, it will help many lives, save many lives that will have complications or minor medical issues that need intervention that will not allow them to go to government hospital. So this clinic will actually help to reduce the workload at government hospital and also promote healthy life for people within this community. So the need of the clinic is something that we cannot overemphasize, So we want to encourage other partners, donors, well-meaning Liberians who are listening to this or watching this this video to understand that the Annie Tido Foundation will need their support so this facility can start to be able to take care of the health needs of the people.
I'm Mrs. Patience Lisette Jane, a registered nurse with Lexings. I am the officer in charge of the Annie Tido health team in Grand Bassa County.
Let's hear from you. What do you know about the Annie Tido Memorial Foundation?
Well, I've actually been with this foundation a couple of years, like 6 years plus. What I know is that this foundation is embarking on an educational program where giving our students academic performances, and then we embark on a health program where we carry on our health fair every year, and also with the school where I do the health education with the students.
Okay. So what about the health program, the health fair that you know about?
The health fair is where we gather community dwellers from every community. We go and publicize around, and we meet on a day where we do their sugar and their blood pressure test.
What impact has it made on the community since you started embarking on the health fair? What are the testimonies from the beneficiaries?
It has been a very great help to the community dwellers because both of them at that time they were in a setting and they don't know their status. But from the health fair, we were able to educate them on their diets. We were able to educate them on some exercise that they need to take, and we were also able to know some of those are pressure patient or are diabetic patient and they don't know. So from the health fair, they were able to recognize and know that they are people with good conditions.
Okay. Now, with all of those processes, the foundation is erecting a clinic. What does it mean? Why is it important to have this clinic operational in this environment?
The clinic operation in the environment is very, very important to the society at large. Not only the community, but to Grand Bassa at large. They also serve as a great help to the health delivery system in the county, where people of the county and the community will be benefiting from. Because from where we stand from the community to the referral hospital is a little distance, and then other people will not be in a position to go right away to the referral hospital. So the clinic being in this community, it will be a great help where our community will have quick access to the health problems.
Are there any recommendation to the owner of the facility?
Greatly, my recommendation is that we appeal to our donors to at least embark on our project. The clinic is already erected, so we look forward for assistance there that they should be open at least this year. Yes, for our community dwellers.
Okay, so we will do a quick walk through the facility to see all of our areas that we will be operating in. So standing right in front of you, we have one of our examination room. This room will be one of the rooms that we will see patients, assess them to be able to diagnose their health condition. It's another room where we will also see patients to be able to diagnose their own condition. We have the pharmacy. We have the pharmacy and dispensary. So the pharmacy and dispensary is where we will store our medication and be able to give our clients the medication so they can be able to take it to improve their health. You know, we cannot make a diagnosis without doing laboratory tests. So this will be our laboratory room where we will run our tests to be able to know what is happening to our clients for proper and evidence-based intervention. We have 2 bathrooms. One will be for the patient and one will be for our staff. We have short stay room. Our facility is not an inpatient facility, it's an outpatient facility. But with that, we also want to stabilize some of our patients who will come with some emergency problem. So we have them be in this room for some time until they can be stabilized before thinking about referring or sending them home. So this is short stay room 1. We have short stay room 2. As I said earlier, this is an OPD facility. We are not admitting patients, but we are also having the capacity to be able to stabilize our patient when they come, to be able to make prompt referral to the next facility for proper intervention. We will quickly move out to the facility.
You have seen the faces behind this amazing cause. You have heard the testimonies from the local residents, from our students that have benefited from our initiatives. You had the opportunity to walk virtually with us through our empty structure. Here's our ask. We are in need of 50,000 United States dollars to operationalize. Why the 50? To get medical equipments, office supplies, medications, and pay our local staff. This is how you can help. Visit atdoemf.org and make a donation. Give medical supplies, office equipments, medications. Partner with us. Join our team. Together, we can save one life at a time. Thank you.